So I had the opportunity to write a commentary on Dr. Alawadi's amazing work on the NCB database, which looks at all of the patients in the U.S. who have been transplanted. And Dr. Alawadi looked at 111,000 patients actually across the U.S. have been transplanted over almost a 10-year period. And he categorized these patients all according to different racial ethnic groups. So the majority of the cohort was white, I think about 70%, followed by non-Hispanic Black patients, non-Hispanic Asian patients, and then Hispanic patients. And we saw he really highlighted very distinct trends that have been occurring over time. Definitely we are optimizing transplant in our treatment for patients with myeloma. And even though there's so many new treatments for multiple myeloma, still, transplant still remains the standard of care for upfront treatment of patients with multiple myeloma, and this is really encouraging to see. It seems as if we're really optimizing our assessment of patients for frailty, optimizing our induction treatments, and it's really good to see that because we know that transplant definitely does have that PFS advantage for newly diagnosed patients. The other thing, though, is that he actually uncovered that there are really certain disparities that impact some racial ethnic groups as opposed to others. So income, for instance, increased the transplant utilization for white and Hispanic patients, but not for Black patients. And the question is why? Is it that there is some implicit bias? Is it that there is, that there are other factors that we're not considering? And that certainly needs to be explored prospectively. But it definitely is something that really made us think a little bit more about the factors that are impacting Black patients and other racial ethnic groups from accessing transplant. But overall, I think it was really a great exercise to see, understand what are the patterns impacting transplant and our patients, and where can we do better? Should we encourage implicit bias training for everyone? Is it that that the insurance, the complicated insurance system here in the U.S. is precluding some patients from accessing transplant? There's lots to unpack there, and so it really is would leave a lot for us to investigate down the road.